For our first main stage session, please welcome the chairman of Oracle Health, Dr. David Feinberg, in a conversation with senior editor, FierceHealthcare, Heather Landi.
Well, hi, David. Thanks for being here with me today.
Well, thanks, Heather. I'm excited to be here.
Yeah, thanks to the audience for joining us this morning after having a fun night with Ludacris last night. Hope everyone had fun. I'm excited to talk to you about Oracle Cerner. So now, with Cerner now joining Oracle, what does this mean for the modernization of Cerner's technology? You know, what can clinicians, doctors, and nurses expect?
So I've joined Cerner just over a year ago. And pre-Oracle, we were really clear that our number one goal was to fix the EHR. And when I say fix the EHR, I'm talking about actually making it more usable for the people who are using it. As I think the only person who's ever run an EHR company that's ever used any of these things, they are clunky, not intuitive, and they don't help clinicians, the nurse in the ER, the social worker, the occupational therapist, the physician get their job done. So we want to really get less clicks, more usability, and that is our focus. Now the EHR has also become an administrative tool, so we got to make sure we get the bill out the right way and finally get all the data back to folks so they can make actionable decisions. Now Oracle shows up, and really what that has done is accelerate our ability to fix the EHR. So we're not taking our eye off of that. It gives us a lot of other opportunities too, but our number one priority is to make this tool usable so folks can get the right information at the right time to take better care of patients.
Okay. So what could this look like in 2, 5, or 10 years?
Well, I think in the next couple of years, we're going to see some pretty dramatic improvements in a couple of areas. One, I think we're already seeing it in interoperability. Not that interoperability is fixed, but with health information exchanges and legislation, and actually our early belief in being open and connected, the data is starting to flow. Now it creates another problem. So if you're that busy doctor who's a hospitalist taking care of a new patient, or if you're an oncologist and get a new referral, you can go to a health information exchange and data is flowing. The problem is there's 400 progress notes that you now have to go through. So what we created, and I think the other companies are doing the same, is a longitudinal record of all of that information that's out there. And then actually, to our surprise, we put a deduplication engine in front. It turns out 99% of problem lists, medications, diagnostics, radiology exams are duplicate information. So we've solved interoperability, but we're now showing you stuff that you got to kind of weed through. So we deduplicated it, put it in order, and then our product allows you just to click easily and put it into the chart. So in the next couple of years, it's going to be easier to find information, find that needle in the haystack, and take care of your patient. And then in your 5-year one, I think we will be free from having nurses spend 50% of their time at the computer. They will be at the bedside. And the voice and those kinds of things will capture what needs to be put into the system of record, and doctors and nurses will be free from the terminal.
Okay. Yeah, anything that can reduce the burdens for clinicians is obviously a great improvement. There's been a lot of focus on Oracle's cloud services technology and what that could mean for Cerner. So what do you see as the biggest opportunities for cloud technology in healthcare?
Well, the biggest opportunity for us right now, and again, I don't want to minimize how we're focused on the usability, is the other things that Oracle brings to the table. So we're really thinking about a cloud-first health platform that connects the EHR with areas that Oracle's been a leader in: supply chain, ERP, human capital management, claims processing, software for pharma. So the use case becomes the nurse is giving chemo for the very first time. Well, we should know that from the human capital management. And then in the EHR, there's just-in-time training. The EHR should be driving what you're ordering for the OR from supply chain. So we think we can create this cloud platform that brings all these components together, and we actually want to do it in an EHR agnostic way, that allows healthcare systems to use all of these sources of data to make better decisions about patients, about populations, and about their operations of their system.
Okay. Was there anything that surprised you once you learned more about Oracle's technology?
Yeah, there were a couple things that surprised me. So there's a lot of times where my new Oracle colleagues are talking about, oh yeah, we've seen this before in other industries. And they keep bringing up those examples. And so they say, oh, we're really good with structured data and unstructured data and putting it together. We do it in our financial services business. And I think, 60 or 80% of the world's transactions run on Oracle, credit card transactions. And I kept thinking, when I go to the ATM and I get $300, I don't write a progress note. So I'm like, what are they talking about with structured and unstructured data in financial services? So I asked, and they said, well, we do a lot of fraud detection. And in fraud detection, you may be looking at an email and there may be a code name for the yacht you're buying, and that is then connected with some banking information, and they can do the tracing of where the money went. I'm like, that is healthcare. That is the progress note and the laboratory, and how do we put them together? That is structured data and unstructured data. So that was one area that I thought was pretty fascinating. And then Oracle has software that a lot of the pharma companies use to run clinical trials. We have our Learning Health Network, which is, we think, the most diverse population of multiple, half research naive and some research institutions that can light up clinical trials and do diagnostics, and how do we pull that together? So those were the two areas that I was pleasantly surprised about.
Right, so as a physician, what kind of excites you most about what Oracle and Cerner can do together?
Oh, so I was a little skeptical or apprehensive. Tech companies think those of us in healthcare are a little stupid. And if we just use this technology, if we just had this app, we could fix healthcare. We've done it for retail and hotel and travel and hospitality and blah, 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 and banking, right? If you guys in healthcare would just pay attention. And I thought that was good. There's a lot of stories of tech companies failing in healthcare. What I have found culturally, which is my answer of why I'm so excited, is my new Oracle colleagues are incredibly humble and inquisitive and really see this as a marriage of the expertise that Cerner has in healthcare worldwide with the amazing resources and technology and success that Oracle has had in other industries. And the other thing that makes me most excited is a lot of those technology swings and misses were point solutions. They came in and tried to fix this part of healthcare or this part of healthcare. And healthcare is so complex and so intertwined and so much wants to go back to its equilibrium that change is hard, and those point solutions weren't successful. What Oracle is saying now is the way we're going to do this different is we're going to take the whole thing on. Now we're going to be open, and we're going to be connected, and we're only going to do that with partners. Like, we're going to do this together, but we're going to take that whole piece on, from signing folks up for their insurance company that Oracle's a leader in, to understanding your copay, to your electronic health record, to claims adjudication, which we think we can do auto adjudication from the claims part and the clinical part, to clinical trials, to understanding HCM and supply chain and ERP, all on a cloud environment, so it can be done more securely and for way, way, way less money.
Right, that sounds really interesting. So let's kind of shift focus a little bit and talk about federal contracts. For those who might not be aware, Cerner has major health IT projects with the Department of Veterans Affairs and the Department of Defense. The VA EHR project has hit some snags. There's been some challenges. So what can you tell us about how that's going, and what does that now mean for Oracle?
Yeah, so let me give some context. I trained at one of the VAs, and I can think of nothing better than being able to serve those that have served us. And for the clinicians in the audience, almost all of us did some time at the VA, and that's where you got to do a lot of hands-on things. So this is really personal to me. The context is actually another EHR company was attempting to start an EHR for the Coast Guard. That didn't go well.
Okay.
And we got invited in. We have now completed the rollout of the Coast Guard, and that then led to the Department of Defense, where I forget 60 or 80% done with DoD. And these are big electronic health record installs, like BAMC is basically an academic medical center, right? That then led to the VA. And we're doing this as one instance. So this is one EHR that will be serving all of those people. So from enlistment to active duty to retirement, you'll be on one EHR. So you won't have veterans or active duty folks carrying their records. Like, pretty amazing, right? We're digitizing this. Now the VA is on a Vista system with multiple installs. We've completed 5 VAs. And today, which hasn't always been the case, we now have folks in leadership positions in the VA, they had previously been unfilled, that have been amazing partners. And what we did after the first 5 installs is say, let's take a breath, let's hit a few things that we think can improve the usability for those great docs at the VA and nurses, and then let's rethink our schedule. So we go live again starting in June, and we're making a lot of progress on that kind of list of things that we wanted to correct. Some of them are things that we don't see in a commercial install, but we're seeing at the VA, and they're actually better care. We just hadn't built it because it's not what the commercial does. So an example would be like pharmacy. The current pharmacy system at the VA lets the pharmacist see what the doctor wrote, and if I wrote a 100 milligram tab and I'm out of them, the pharmacist can change it to 250s. Well, that doesn't happen between CVS and a commercial place, right? And so they're on different systems. So the VA appropriately is saying, we want to have what we currently have. So those are the kinds of things that we're doing over these next couple months, and then we think starting June we'll be back to those rollouts. Okay,
yeah, it's obviously a massive, complex project, and it'll be interesting to watch it over the next few years.
Biggest EHR install in the history of EHRs.
Yeah.
there will be snacks.
Of course. So let's talk a little bit about interoperability and data integration, which you had kind of touched on earlier. These are obviously really important things in healthcare. And Oracle Chairman Larry Ellison recently laid out a very bold vision of building a national health records database. So how will you approach this?
Yeah, so actually Larry was here in Vegas a couple weeks ago for the Oracle Cloud Conference. So this is everything to do with Oracle. And he gave a keynote that was 48 slides, and 42 were healthcare. And he has said very, very clearly that the mission of Oracle is health. Right? So this is a huge shift and focus. And I think a differentiator from some of the other big tech companies that maybe are putting their toe in the water. Now sometimes it's a pretty big toe, but this is Oracle jumping in the water. And Larry's vision is really one that we're working toward. So to get to that vision, we got to make the EHR usable, right? We can't have people burnt out and quitting medicine because this thing is so hard to use, right? So that's first. Then we think we can make it more intelligent by connecting it with those other systems, ERP, supply chain, by understanding clinical trials on top of that, by solving the interoperability problem, by making that longitudinal record for an individual patient. When we get to that point, and this is something that Larry said also, this is not Oracle doing this. This is Oracle doing it with the industry. So with partners, if we can really make a usable system that's, we've digitized the record. Now let's take all that information and make it usable so we can do AI and predictions on top of it. And then you as an individual, or you as somebody caring for your family, or a person responsible for a community with the right safeguards in place, and Oracle's a leader in this safety space, we can then really create what all of us want is my information in a way that I understand and allow me to share it with those who are caring for me, both my family or loved ones or professional caregivers. So that's the vision that we're working toward. And it's actually really, really exciting. And I want to emphasize, we're doing this with everyone else.
Right. So what role do you see Oracle playing in interoperability going forward?
Well, Cerner is the largest EHR company in the world. So our market share is significantly bigger than anybody else's in the EHR space in the world. And what I say to the team, what that means is we have more of grandma's blood sugar than anyone else. So let's remember that. Let's remember that this healthcare starts with trust. We got to get that blood sugar, we got to protect it, we got to get it to the right place, to the right people, and if grandma needs nutritious food, that's really the most important thing about the blood sugar. So to me, what Oracle plays, if we're going to be successful, healthcare is making sure that everybody's got access to care, that care is equitable, that it's high quality, that it's affordable, that it's based on trust, it's about people caring for people. And then Oracle and others can provide the technological tools to allow people to do their job better. And that could be, a mom taking care of kids at home or elderly parents, or that could be a telehealth visit, or that could be in an acute care setting, or that could be a government worrying about adverse effects from COVID vaccination. So Oracle built the vSafe program. I think it gave them the confidence to then jump in even further. So that's the way we see it, is that we're really an enabler of the care that's so important, and that enablement is really taking disparate data sources, normalizing them, getting rid of the noise, and then providing it to people when they're actually caring for other people.
Right, right. So with mergers and acquisitions, often the biggest challenge is the integration process. And I know it's early days, but what can you tell us about how that process is going, or how you anticipate it going?
So my wife kept asking me, why do you keep checking your phone? I'm like, I want to see if my Oracle paycheck came through. So it wasn't so much my paycheck, but I thought there's 25,000 people at Cerner, so it was my best test to see did it happen. We got new emails, we got our paychecks. 2/3 of people at Oracle are there via acquisition.
Oh.
So it's pretty fascinating when I'm meeting my new colleagues, the majority have come from the outside. So Oracle is really good at this. So they're a machine in the kind of nuts and bolts of bringing in this case, 25,000 people. They actually brought forward 99.6% of us. Pretty amazing. The bigger issue is the culture. And I think when you study mergers and acquisitions, well, for sure you got to get the emails right, but assuming you get that part right, how is this going to go from a cultural standpoint?
Yeah.
And as I mentioned earlier, I was a little apprehensive. There were a couple decisions that Oracle made that I thought, oh, here we go again, like almost $30 billion, and you guys think you're going to do it this way? Every one of those decisions, they have reversed. This is really a marriage, and Larry talks about it, between a company that for 40 years has understood healthcare and been with partners and built their systems and supported them, and a company that has in other industries used technology to completely change it. And how do we bring that together in the best way? Today, I am wildly optimistic that this is going incredibly well.
Okay. So your expertise in healthcare, obviously encompasses, you're a physician, you've been a health system executive, a health tech executive. So what is the biggest improvement that you would like to see in healthcare?
We had a dinner last night with about a dozen people, and the host asked that question. And I was to his left, so I got to go first. He said, Dave, why don't you go first? And here's what I said. We built the system around the wrong person. We've built the system around the hospital and the physician. We need to rebuild healthcare, and I think we're on our way, around the patient, the family, and the community. We have lost our ability to love one another, and I think that's really important in healthcare. Because I think technology's got in the way. I think finances have got in the way. I think we've done so many things that have been distracting around, and I said this last night, I don't care where you live in the world. If you get cancer, it sucks. And what do we do for that patient and that family and that community to say, we'll take care of everything so you can focus on getting better and not burden you with EOBs and not burden you with access to care and not burden you with, am I on the right treatment, and not burden you with issues other than focusing on yourself, spending time with your family, and connecting with your care team to live your best life. So I think the biggest shift we need to make, and I think value-based care helps here, is moving from a system that was really designed around the wrong person and move it to the right person. And the right person is all of us when we twist our ankle or something bad happens or we want to do some prevention. Make it easy for me to do that stuff. Get rid of the noise.
Right. Well, David, thank you so much for sharing your insights. It's been great chatting with you.
Thank you, Heather.
Thanks, Heather and David.